बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि व सल्लि अलैहि. Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is a female patient for anomaly scan. So I am going to scan the fetus. Here we can appreciate this is the fetal skull, and it is surrounded by this hypoechoic area, that is the subcutaneous edema. So scalp subcutaneous edema is present. This is the echogenic line is the skin. These are the bones, and this is the fetal brain. And then when we drag the probe downward, we can appreciate also these hypoechoic area, which is the subcutaneous edema, is also seen. And then this is the lower limb, that is also having the subcutaneous edema. So we can say that there is a generalized subcutaneous edema of fetal whole body, including the skull vault. So when this one thing is present, then we should concentrate on the fetal abdomen and the fetal heart and lungs. So this is the fetal lungs. So this is the fetal lung, which is floating within the fluid. This is the pleural effusion. So pleural effusion is present, and this is the white tissue is the lung. So bilateral pleural effusion is present. This is the fetal heart, which is displaced at the middle due to this bilateral pleural effusion. And now we are going downward to see the abdomen of the fetus. And so this is the abdomen, and this is the ascites. So we can say that this is the case of Hydrops fetalis. We can say only Hydrops fetalis at that time when the fluid is present in the two compartments, whether they are the skin edema plus ascites, or skin edema plus pleural effusion, or pleural effusion plus pericardial effusion, and so on. So this is the case of Hydrops fetalis, as the fluid is present in the pleural cavity, ascites is present, and the generalized subcutaneous edema is present. So three findings are present. There should be at least two findings, two fluid accumulation in two compartments. Then we can say that it is the Hydrops fetalis. I have seen that this is almost 18-year gestational age, and at this age there is a Hydrops fetalis, so likely it is the non-immune Hydrops fetalis. When the non-immune Hydrops fetalis is present, we should also see any fetal cause, because non-immune Hydrops fetalis is usually due to the fetal cause, while the immune Hydrops fetalis is due to the maternal cause, in which the maternal blood group is negative and the fetal blood group is positive, and the antibodies present in the maternal blood crosses the placenta, and then they attack the antigen of the fetal RBCs, and then hemolysis occur, and due to hemolysis severe anemia occur, and then is a Hydrops fetalis or the SAT, profusion and skin edema, subcular edema. So when we are talking about the non-Hydrops fetalis, what would be the causes of causes of the fetus that has caused the non-immune Hydrops fetalis? So first we look any infection. Due to the torch infection, calcification can occur in the fetal brain. When the inflammation is present, there is a increased capillary permeability, then this fluid leaks to the subcutaneous tissue and the edema occurs. So I have seen this patient, the brain thoroughly. I could not find any calcification within the fetal brain, and also patient is not giving any history of infection, any history of vaginal discharge. So one is this cause, the torch infection. Other is the fetus, which is the common, may have cardiac failure due to cardiomyopathy, or due to arrhythmias, or due to some congenital cardiac defect. When this occurs, there is cardiac failure, and then when the cardiac failure occurs, there is a venous congestion, then fluid leaks out of the vessels and then accumulate in the subcutaneous tissue and is the edema. Here I have seen that there is no such pathology within the fetal heart. Then third is there may be thalassemia major in the fetus, usually alpha, that can cause the low plasma protein, and then anemia, and then fluid due to oncotic pressure जो होता है, इसकी वजह से oncotic pressure increase हो जाता है, and then low plasma level की वजह से then fluid leaks through the vessels and then accumulate in the subcutaneous tissue. But here we sonographically we are unable to detect the thalassemia major. However, we can then go for the middle cerebral artery to see the anemia, in which the peak systolic velocity is increased. And then fourth one is there may be some lymphatic obstruction that may be due to Turner syndrome or due to the Hygroma. When there is a lymphatic obstruction, we should see the fetal sex, and then we should see the cystic hygroma. and any other abnormalities which we can find in the Turner syndrome. You can read this Turner syndrome in the literature. So when we are talking about the cystic hygroma, which may be the cause the lymphatic obstruction and hence the edema, we should see the neck of the fetus. Here this is the neck of the fetus, and we can appreciate this septated area. This one. This is the neck of the fetus, and septated area is present on both sides of the neck. So this is the cystic hygroma. This one you can see. This is the neck, and this cystic area is present at the neck of the fetus on its lateral side, posterolateral side. So here in this fetus, the obvious cause of Hydrops fetalis is this cystic hygroma. Due to this lymphatic obstruction, also fluid leaks out under the transudation action and then accumulate in the fetus subcutaneous tissues. So this was the. So we have seen that this fetus is having cystic hygroma, due to which fetus develop the subcutaneous edema, then ascites, and then the profusion. So whenever you come across the Hydrops fetalis, we must see the four things. Number one, skin subcutaneous edema. Number two, pleural effusion. Number three, pericardial effusion. Number four, ascites. So these should be present. Almost two or more than two should be present when we are labeling the fetus as Hydrops fetalis. And when there is immune Hydrops fetalis, there would be severe anemia. In this fetus, non-immune, the anemia is less common as compared to the immune Hydrops fetalis. So when there is the immune Hydrops fetalis, we should also check the fetal middle cerebral artery, which will show the high peak systolic velocity. Then we will come to know that patient is having severe anemia, and which is due to the fetal RBC hemolysis. And also then we will ask the patient for the blood grouping. But if we talk about the sonographic picture, we should see the cause. In immune, usually, most commonly, the middle cerebral artery will show the high peak systolic velocity, while in the non-immune, it is less common. So this was all about the fetal Hydrops fetalis, non-immune versus immune. I have seen the middle cerebral artery that is within the normal range in this fetus. And when we come across the head of Fetalis, we should also see the amniotic fluid. Here the amniotic fluid is little bit increased, and also we see the placental thickness. This is the 18 weeks gestational age, and if we measure the placental thickness at the mid substance of the placenta, it is 3.5 centimeter. It should be according to the gestational age, that is 1.8 centimeter. Here it is the 3.5. So the placenta also is enlarged, is bigger in size than the usual due to the edema and of the placenta. So this was all about the fetus. What is the findings? Subcutaneous edema all over the fetal body, including the skull vault. Then is the pleural fusion. Then is the cystic hygroma, and then is the fetal ascites. Other secondary findings are increased liquor and increased placental thickness. Thank you very much.